All right, so I want to get started on the stomach acidity. I'm excited about this because if you are one of my functional medicine patients, you know that I've reached out to you and said, hey, did you go through the stomach acidity information? And I'm actually going to post this recording in the course. But this is really important to get right for everything else. So whether or not you struggle with heartburn or you've been on Prilosec, this is something that can lead to a lot of other problems. And we're going to kind of go through that this morning. But we have to get this right. Like, this is at the root of a lot of different things. And I feel very passionately about this because in the clinic, I mean, we're taught that if someone comes in with heartburn, the treatment for that is a proton pump inhibitor. So those are going to be medicines like Prilosec, Nexium. There's lots of different names, omeprazole. And I use it like there's a really good analogy of, let's say that you have trash in the trash can that smells horribly, and you come in and you spray Lysol. You make it smell better temporarily, but you're not like, you have to at some point take out the trash. And I think that this is something that in the conventional setting, we've really done a disservice to patients and to providers, because I can guarantee you that there are not a lot of providers that have researched, okay, why is our stomach acidic in the first place? And why do we use these and how long? So from a medical person, just in that setting, I would prescribe the medicine. All the literature says try not to have people on it long term. We see that it's linked to this, this, and this, but there's no real like why exactly and how do we get people off of it once we've put them on it. But I'm here to tell you that if you're on it and you've been on it for a long time, there is hope. And I am not saying by any means that you should go against what your doctor is saying. You absolutely need to partner with them. But I do think that we need to be asking more questions about what the long-term effects of these medicines are, and really just be more informed from a patient perspective so that you can advocate for yourself. And I just feel like I was in the dark about this for a long time. So, I'm trying to get the word out because this is significant. And I've seen in working with the patients that I work with now, when we address this the right way, the outcome is so much better than when we're just putting people on medicine. Towards the end, like in the last year or two of being in the clinic, I saw so many people on Prilosec or Nexium long term that developed severe iron deficiency anemia to the point of requiring blood transfusions. And there was no other explanation except for that what they all had in common was being on long-term proton pump inhibitors. And as we go through this PowerPoint today, you're going to kind of see like why our stomachs should be acidic and what happens when we make them not as acidic as they should be. So going back to the trash can analogy, sometimes we do need to use medicine. We do need to spray Lysol while we work on taking out the trash. So it's not always like only take out the trash or only use Lysol. We have to use both. So sometimes there are situations where absolutely these medicines are indicated for a short period of time. But they are incredibly overprescribed with very little instruction from providers, to the patient about what the long-term risk is, how long they really want you to be on it, and how to get off of it. A lot of times they'll say, take it for 4 to 6 weeks. Okay, well then what happens when I stop it and my symptoms come back and I have no tools in my toolbox for how to deal with that and what's really going on? So that's what I want to go through today. You guys can tell that I'm very passionate about this. So first let me share my screen. So all of you who are functional medicine patients, I want to show you in Get Healthy, like in the functional medicine program. You're going to go to, why is my mouse being funny? Okay. You're going to go to week 8 where it says improving your stomach health and acidity. And then this is what the handout looks like. I'm going to go through this in a little bit more detail. But this is the resource that you all have. If you would like a copy of this resource, please let me know. For those of you watching the replay or anyone, I'm happy to share this with you. But it's going to go through what we're talking about today and with instructions for how to test your stomach acidity. And again, we're going to go through all that, but this is what it looks like. It's 2 pages, so make sure that you go all the way like to the second page, read through everything. But let's go through the PowerPoint here. It was kind of being a little funny earlier when I was trying to be in present mode, so I might have to tweak it a little bit. But okay, so let's go through. Let me move my window here. So stomach acid levels. So just as a refresher, some of you may know this, some of you may not, but a normal stomach acid level is a pH of 1.5 to 2.5. And what's interesting is that as we age, the parietal cells in the stomach, which is what produces the stomach acid to begin with, it's hydrochloric acid. As we age, even from the age of 40, people already have suboptimal stomach pH. And it continues to decline as we age. So by the time we get to 60, half of people have low stomach acid. And by 80 to 100% of even healthy people, this doesn't necessarily have a ton to do with like whether or not you exercised or managed your stress or ate well. Like this is just a normal part of aging. And just to, I mean, I think a really big part of understanding why this is so important is looking at, okay, well, what is the purpose of stomach acid to begin with? So it's our first defense against food poisoning. H. pylori, which is an infection that you can get in the stomach that causes lots of nasty symptoms, parasites, and other infections. So when that food or whatever pathogen hits our stomach, when it is the proper acidity level, it kills it. So you can imagine that when we are putting specifically things like pills in that neutralize that, we don't have the same protection. So you're more at risk for food poisoning, H. pylori, parasites, and other things. Without adequate acid, we leave ourselves open to decreased immune resistance and lots of other health problems, which we'll talk about in just a minute. And something in particular, small intestinal bacterial overgrowth, which is where we get an overgrowth of bacteria in the small intestine, which typically does not have a lot of bacterial growth. It happens in 20% of people, ages 60 to 80, 40% of people over 80. And a lot of times where that's stemming from is because we have not had good stomach acid, and it's really affecting the transit time. When that food is moving through your digestive system, it sits there too long because of suboptimal stomach acidity. Says my internet connection is unstable. Hopefully it's okay. So when we talk about adequate HCl, so HCl is a hydrochloric acid. Stomach acid is necessary for the absorption of minerals, vitamins, protein. So you can be eating a high protein diet. I talk to so many women who are like, I'm trying to eat more protein. I'm not really seeing a whole lot of benefit. I feel bloated. I still can't lose weight. This is something that we absolutely need to work through. And back to kind of what I said about the iron deficiency and blood transfusions, adequate hydrochloric acid is necessary to absorb B12, iron, calcium, magnesium, zinc, copper. Our stomachs have to be acidic for us to be able to absorb those things. So you can be taking all the supplements you want. You can be eating as healthy. And if you don't have proper stomach acidity, your body is not going to be able to absorb it. There are a lot of symptoms that you're going to have with these deficiencies, like B12 deficiency causes weakness, fatigue, nervous system problems, also very common with things like anxiety. And then, like I said, with the protein, I mean, you can be eating all the protein you want, but if your stomach acidity is not optimal, it's going to be very hard for your body to break down the protein bonds in the stomach. And what's interesting is that poor acid content actually causes indigestion. So the symptoms of hypoacidity often mimic the symptoms of hyperacidity. But when we go, when we see a patient just from a clinician standpoint, or you go to your doctor and you complain of these symptoms, we automatically think, oh, you must be having too much acid. We need to give you something to neutralize it. But what happens when there's not enough is that does not, the low acid does not give the message to the pancreas that you need digestive enzymes, and it doesn't give a good squeeze to move that food through. So it sits up here and gives you the same symptoms that you would have if you actually did have hyperacidity. So what are some things that are going to alter your stomach acidity? Obviously, medications, acid blocking medicines increase your stomach pH to 3.5 to 5.5 or higher, which obviously is quite a ways away from where we want it to be optimally. It's not ideal, and it does not give adequate signals to the pancreas to secrete the digestive enzymes and that pyloric sphincter to constrict and prevent reflux. So all of that works together as a process. That's how the human body was designed. And putting a Band-Aid and making your stomach less acidic often, then this is why it's so hard to get these patients off of these medicines. Because when they try to get off, even though their stomachs, do become more acidic, that whole signal process is just not working properly. So hypochlorhydria is caused by chronic H. pylori infection, treatment of proton pump inhibitors. We're not going to get into like the autoimmune gastritis and mucolipidosis and all that stuff. But I do want you to see just common symptoms of hypochlorhydria is upper digestive tract gassiness, bloating, burping, burning, especially after meals. If you see undigested food in your stool, we often see this too, like itching around the rectum, chronic candida infections, parasites, and one of the biggest things that we see with low stomach acid are skin conditions. So we'll see acne, a lot of times like red, hyperpigmentation in the face, like rosacea, sense of fullness after eating, nausea, multiple food allergies, and then weak peeling fingernails. So these are all downstream effects of stomach acid not being optimal. So one of the tests I look at in functional medicine is called a CSAP. It's one of my favorite tests. And specifically, we're looking at elastase, which is one of the digestive enzymes. We always want to make sure, like with functional labs, I'm always looking at things that are optimal versus just normal. And so we want that number to be at least 500. That's not really important for you guys to know, but if we're working together, we'll kind of go through that. But it is possible to have a normal elastase and still have an issue with stomach acidity. So that's just something we kind of work through together, but not, I'll mention it because it's on here, but not super important for you guys. So let's look at some of the diseases associated with hypochlorhydria, and that would be a really long list. I'm not going to go through all of them, but gallbladder disease, we often see asthma, celiac, autoimmune disorders, and then you'll see a lot of skin conditions on here, hives, dermatitis, lupus is autoimmune, rosacea, psoriasis, like I mentioned, acne. So all of these things can be traced back to the root of a lot of gut dysfunction, but even further than that, stomach acidity being suboptimal. So how do you know that you may have low stomach acidity, and what do we do about it? So this is all about self-testing and treatment. So what we do is I would have you take, and I highly recommend working with a practitioner on this, whether it be a functional medicine practitioner or your doctor. But begin by taking 350 I would start with 350, a capsule of betaine HCl, which is hydrochloric acid, with a protein containing meal. So typically I'm going to tell patients to take this with lunch or dinner because they're higher protein content. So a normal response if you have good stomach acidity is that you would develop heartburn if you took that. So if you don't feel burning sensation, then we're going to increase it to 2 capsules with each protein containing meal. I do recommend waiting 2 days, like stay with the same schedule for 2 days before you increase it, just to make sure that you're really, we don't want to go too fast. So if you want recommendations on the specific supplement that I would recommend, I can send you that from my e-store. But I would recommend starting with 350, take one before the protein containing meals for 2 days. If you don't have a reaction, then the next day go to two. And you're going to continue to increase the number of capsules every 2 days. You can take up to 5 capsules if necessary, but I don't take my patients much higher than 5. That would be very rare. And it also depends on your body weight. So if your body weight is higher, obviously you'll probably take more than someone who weighs less. The dosages might seem large, but make sure that you just kind of remember that the normal functioning stomach manufactures considerably more acid than what these doses are. If you've taken too much, you will have like heartburn, GI discomfort, and I mean, it can make you feel just kind of odd. So to neutralize that, it's really easy. You just take a teaspoon of baking soda and water and milk. I recommend doing it with water and milk, just sounds gross to me. And then you would back down on the dose. But most of the time, whenever I'm walking through this with patients, they don't get to the point where they feel that uncomfortable. So again, when you reach the state of tingling, burning, and the other type of discomfort, you cut the dose back by 1 capsule per meal. So let's say you were up to 3 and you felt those symptoms, you took the baking soda and the water to neutralize it, then the next time you would go down to 1. And then once you have established a dose that causes no symptoms, you continue that dose until we meet again, until you see your doctor, or until you start developing symptoms that you experienced with, the tingling and that sort of thing. And then we would step it down again. And I kind of steer people away from taking it with smaller meals. So definitely want to make sure you're doing it with your larger meals. Oh, good. It worked. Okay. So the idea is that we are having individuals that have hydrochloric acid deficiency regain normal HCl secretion, and over time, you might develop symptoms of heartburn whenever you take the HCl, and that's why I recommend, cutting it down. And that's why it's so important. That's why I have my program, this set up as a program, because I'm walking through this with you. So it's never like well, gosh, when do I go back to see the doctor? I mean, you guys know that I'm always available. So if any of you, whether you're functional medicine or not, try this, please reach out to me if you need any guidance. So yeah, here's just a note about like, if you have moderate to severely low HCl, you typically don't experience a quick improvement. So you have to be consistent with it. This is not the kind of thing where you like do it a couple days and then everything's fine and you stop it. You really do have to be consistent. Now, this next part is really important because this is where there's quite an art to this and not just a science. But let's talk about kind of how I would approach this with someone. So, a high MSQ is basically an MSQ is a medical symptom questionnaire that I give functional medicine patients. It goes through every single body system and asks about certain symptoms that they have. So what this means for you is that if you don't feel well, if you have a lot of complaints, if you have fatigue, bloating, diarrhea, anxiety, pain, like all that kind of stuff going on, or if you have a past history of peptic ulcers, it's important to know that if you have peptic ulcers, this is contraindicated. So you cannot do this if you have a peptic ulcer. But if you have a history of it, a lot of times I will start with apple cider vinegar instead of the hydrochloric acid, just to kind of ease into it a little bit more gently. So step 1 is to just use a tablespoon of apple cider vinegar 1 to 3 times a day for 2 to 8 weeks. And bonus, if you add a tablespoon of ginger juice and lemon juice, organic would be preferable. That is really helpful for balancing your stomach acidity. That's what I would recommend. Like if you're not working one-on-one with a practitioner, or you talk to your doctor and this isn't something that they are highly trained in, which I wasn't until I really studied functional medicine. but this is what I would start with. This is very safe. It's easy. This is a really good place to start. So organic, raw, unfiltered with the mother apple cider vinegar, organic ginger juice, organic lemon juice, is a great combination. Okay, I don't need you guys to worry about that. That's just more like from a clinical standpoint. So I did want to talk about just really quickly, let me stop my screen share. So how to kind of approach this if you are on proton pump inhibitors, which I know that a lot of you have reached out because you are. Again, this is more like an art, not a science, but what I have found helpful in the clinic and also working with functional medicine patients is if you have been on Nexium, Prilosec, any of those medicines long term, a lot of times you probably will find like you started on a lower dose and you may or may not have had to go higher because again, when we're just spraying Lysol, it's like pretty soon the Lysol wears off and it stinks even worse and we have to spray more. So you go back to the doctor and they increase the dose and tell you to take it longer and it's just the cycle continues. So the first step would be to reduce the dose. And it can also be helpful to add an H2 blocker that works a little bit differently than proton pump inhibitors as far as neutralizing the acid and can be a good, I don't want you to stay on that for forever either, because at the root, it's still affecting you the same way. But a lot of times it's really helpful to kind of do a step down. So that would be, they took Zantac off the market, but famotidine, Tagamet, those medicines are H2 blockers, and you can Google it. And like if it says H2 blocker, that's better than the proton pump inhibitor. So if you take things like Prilosec, Nexium, decrease the dose and add something like famotidine, oftentimes I'll tell people to do that in the afternoon while you start the apple cider vinegar, ginger juice, lemon juice combo. And then we do that for 2 weeks, make sure you're feeling well. And then we would move the proton pump inhibitor to every other day and keep the famotidine every day. And we keep stepping it down. And then once we finally get off the proton pump inhibitor, then I would start reducing the famotidine, all while continuing the apple cider vinegar, being really consistent with that. And at some point, ideally getting you totally off the prescription medicine and going up to the betaine HCl, to really make sure that your stomach acidity is optimal and to reduce the heartburn symptoms. So making sure that your pancreas gets that message that, okay, we need to close the pyloric sphincter. We need to push everything on through, and that in the end will help all of your symptoms. So anyway, kind of wordy, maybe a little bit complicated, but takeaway would be start low with the apple cider vinegar, move on to the betaine HCl. Again, all of my functional medicine patients really, really, really want you guys to work through this. And make sure that you're working with a practitioner that can help guide you through it. It's not the same for everybody. If I could like write a chart up here for what to do on what day, that would be awesome. But everybody is very different. It depends on how long you've been on the medicines. Remember that weight reduction helps symptoms of heartburn. So as we work on weight, we work on stress, lifestyle, that is really the ultimate recipe for success in being able to get off of these medicines and stay off of them long term. If any of you have any questions, please reach out to me. Let me just check the chat and make sure. Yeah, we're good. Okay. And if you want a handout of the stomach acidity that I showed you guys that's in my functional medicine program, I'm happy to provide that to any of you. But reach out with any questions and have an awesome Friday.